Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of March 2025 includes stories about a recent study on First Nations parents' high rate of contact with CFS, student exchange trips to New Zealand, oral cancer screening clinics on campus, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing Team. A knowledge exchange trip to New Zealand in 2024 was life-changing for Shayna Moore, a recent College of Nursing graduate. Moore was one of 6 Indigenous nursing students who traveled to New Zealand for 2 weeks to learn with and from Maori nursing colleagues. The experience was fully funded for students by Global Skills Opportunity, a Government of Canada program in partnership with with wraparound support funding from First Nations Health and Social Secretariat of Manitoba. The trip was supported by Makwa Amushki Kim, Pathway to Indigenous Nursing Education, or PINE, an initiative that provides academic, personal, and cultural support to help First Nations, Métis, and Inuit students entering the Bachelor of Nursing program. The trip was designed as a unique experience for Indigenous nursing students to meet with others in the global community and create awareness for them about global health. Moore said that not only did she learn about the culture of the country's Indigenous people, but she also returned more in touch with her own.
When we went to New Zealand, we did so many ceremonies over there, and they were so open to us, like, actually doing those ceremonies and stuff. So I was like, okay, so when I came back home, I was like, okay, this is something that, I can do. They really opened that pathway for me. So like I said, I came back, I learned how to make moccasins, I learned beadwork. I think those were really the 2 things. Kind of like more cultural things, like smudging and stuff. I smudged for the first time in October, and it just keeps building and building as the months have gone on.
Moore said that getting close to her culture led her to join PINE as a skills education coach this year. In that role, she looks forward to helping Indigenous nursing students on their journeys.
Now in PINE, I'm a skills education coach, so I focus on supporting Indigenous students throughout their skills. And then I'm also a co-facilitator for the blanket exercise. And so I feel like also that, recently they just brought in Ongamazin to do that. And so one of the elders over there, shared with us the last time we did it, a pipe ceremony. And that was the first time I got to experience that. So I feel like, as the years go on, it just continues to build with more that I'm able to experience. So I'm very happy to be back in PINE because I get to see it grow and kind of see more culture kind of hopefully come through and things like that.
March was Juvenile Arthritis Awareness Month. The disease can hold children back from certain activities, but there are treatment options available. Dr. Lily Lim, a pediatric rheumatologist at HSC, Winnipeg Children's Hospital, and associate professor in the Department of Pediatrics and Child Health at the University of Manitoba, spoke with CBC Manitoba about the condition.
I think there's a big misconceptions in the general public, and perhaps also even in some parts of the medical profession as well, that arthritis is an old people disease. It is not. Juvenile arthritis occurs in about 1 in 1,000 children. It is the most common chronic childhood rheumatic disease, and it will follow children into their adulthood.
Oral pathologists and residents from the Dr. Gerald Nisnik College of Dentistry screened more than 200 people for oral cancer at a pop-up clinic on the Fort Garry campus at the end of March. Dr. Vimy Mutalik and Dr. Mohammed Hassan Kadhim organized the event that was open to the community. Mutalik said they screened significantly more people than they anticipated.
The goal of these screening events is to just raise awareness about the incidence of oral cancer and precancerous conditions that are here in Manitoba. We just want more and more people to be aware that these cases can be asymptomatic most of the time, you may not be aware that these kind of lesions are growing in your mouth. So just
Mutalik said another goal of the pop-up clinic was to provide a service learning experience for residents and students. Dental hygiene student Elizabeth Fust volunteered to help at the clinic because she wanted to broaden her knowledge and collaborate with the residents and dentists screening the patients.
Just as students, we want to kind of broaden our scope of what we can do in practice. So this is an opportunity just to work with the other residents, like the periodontal residents and dentists, to collaborate and promote oral health, and just to get some experience from them also and gain experience in seeing lesions in the mouth so that we can better diagnose when we get into private practice as well.
The organizers held their first oral cancer screening pop-up clinic on the Bannatyne campus in October 2024. They have plans to take it on the road to rural Manitoba in the future. A joint study by the Assembly of Manitoba Chiefs and researchers from the University of Manitoba reveals that First Nations birthing parents in Manitoba experience significantly higher rates of contact with Child and Family Services compared to non-First Nations birthing parents. The study was published recently in the international journal BMC Public Health. The researchers analyzed de-identified government health and social service data that is stored in the Population Research Data Repository at UM's Manitoba Centre for Health Policy. They studied the 20-year period from 1998 to 2019, tracking data for more than 13,000 First Nations birthing parents and more than 106,700 non-First Nations birthing parents who had their first child between those years. Dr. Kathleen Kenny, a postdoctoral fellow in community health sciences at the Max Rady College of Medicine, who led the study, spoke with APTN about the results.
What we found was that 1 in 2 First Nations parents had involvement with the system as a parent, and that this was almost 4 times higher among First Nations parents compared to non-First Nations parents. We also found that First Nations parents, that over 1 in 4 had experienced apprehension or removal of their one or more of their children in the study period, and that this was almost 6 times higher among First Nations parents compared to non-First Nations parents. And we also looked at termination of parental rights, or the rate of parents who experienced having a child become a Crown Ward, or 1 or more children become Crown Wards, which is often an outcome that is not focused on in research and data looking at this system. So when we looked at that metric, we found that almost 1 in 10 First Nations parents had experienced the permanent termination of parental rights, or having their child become a Crown Ward. And I think we expect to see inequities in the rates between First Nations and non-First Nations parents based on previously published data. These numbers are incredibly high, showing a wider scale of disruption to families than previously published data. And I think for people who don't live it and see the effects of this system every day, that disruption by this system that we show in the study period of 20 years is wider in scope than many would appreciate, specifically non-Indigenous people in Canada.
Kenny's group made several recommendations as a result of this study, investing in First Nations-led preventative supports and the resurgence of holistic wellness for First Nations parents at risk of contact with Child Protective Services, including the establishment of community-based supportive spaces outside of Child Protective Service agencies. Wintana Makonnen, a second-year respiratory therapy student at the College of Rehabilitation Sciences, had only first heard of her chosen field of study 4 years ago while volunteering at the Health Sciences Center. Today, the 21-year-old is a passionate advocate for the program. Makonnen runs a student Instagram page for the program with help from some first-year students to spread the word about RT. She also works at HSC's Women's and Children's Hospital as an RT assistant, a role that was created for students during the COVID pandemic to address the need for more respiratory therapists. Makonnen was born and raised in Winnipeg. Her parents moved to Manitoba from Eritrea, Africa, in 2003. The middle of 3 children, she had an interest in healthcare from a young age and was inspired by her mother, a healthcare aide for nearly 20 years. UM Today recently spoke to Makonnen about what she loves about respiratory therapy.
We are such a big part of the healthcare team. Like, we're always at the bedside, at the head of the bed. and we're always making sure like we're talking to our patients, we're making sure we're trying to give them the best care possible. And yeah, it was just a lot of contributions we make to the team that I feel like a lot of people don't know about, let alone like what the career itself is. But I feel like once going through clinicals, I'll probably get a better idea of where I want to be, what I want to do. I think right now I'm definitely considering pediatrics and neonates. I really like that environment and how specialized it is. But I'm also thinking about, other avenues, maybe pursuing education. Looking at working rural has always been a passion of mine. It's a little bit difficult just because there aren't a lot of jobs available, but if that was to open up like a job where we could go up north, I would love to do that.
A group of students from the Rady Faculty of Health Sciences recently returned from a trip to the Amazon, where they learned from traditional South American healers. The students traveled from February 14th to the 23rd and spent most of that time in the rainforest in Amupacan, a birthing center run by a collective of traditional Quechua midwives known as mamas. 5 students from the College of Nursing took part thanks to a $6,000 endowment fund. This included 4 nursing students from the Bachelor of Nursing program and 1 from the midwifery program. Courtney Chartrand was one of the nursing students on the trip. A mother of 3, Chartrand grew up in Winnipeg, but is a member of Sag King First Nation. She said she felt a connection between the culture she experienced and Indigenous culture in Manitoba, particularly when it comes to the use of natural medicines.
Something I kept thinking while I was there and we were spending time with the mamas, like there was one day that we went out to one of the mamas' houses, and so we took a taxi ride about 20 minutes off of the property from where the mama's birthing center was, and then we just stopped on this road, middle of the road, got out of the taxi and followed the mama through the Amazon jungle for about 30 to 40 minutes, and just like green everywhere, and it was raining, and we were following her down this trail, like going further and further into the jungle. And I kept thinking, like, this is just their way of life. This is just natural to them. And I kept thinking, like, how beautiful is this woman? And she's carrying, like, this big basket on her shoulder, and she's got, like, a machete, and she's, like, it's just like her way of life, and it was so beautiful. And I kept thinking the mamas are so beautiful, just the way that they live on the land and they harvest, their medicines.
The Office of Interprofessional Collaboration is planning another trip to the area in May. 12 students in the College of Rehabilitation Sciences and Pharmacy will participate. This year's Doctors Manitoba Award winners all have strong connections to the Max Rady College of Medicine. 8 of the 9 award recipients are alumni, and 7 earned their medical degrees at All 9 physicians hold positions within the Max Rady College of Medicine, including Physicians of the Year, Dr. Michelle Bruno and Dr. Selena Papetti. Bruno is a clinical teacher of family medicine, and Papetti is a lecturer and associate head of distributed medical education in the Department of Family Medicine. They not only share a clinic in Lac du Bonnet, Manitoba, they also share commitment to rural medicine and a vision for its future. Together, they are inspiring the next generation of family physicians and sparking an interest in rural healthcare among medical learners. Dean of the Max Rady College of Medicine, Dr. Peter Nickerson, was thrilled to see that all the award winners have connections to the Medical College. He said, "This exemplifies our mission to train outstanding physicians who then become impactful healthcare leaders." A gala to celebrate the award recipients will take place in May. Thanks for joining us today. What did you think? Send us your ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by visiting our Today Rady Network news site at news.umanitoba.ca/network/Rady Faculty of Health Sciences.